Almost 2.5 years ago, when I became chair, I first walked through our clinic, which is a multi-specialty clinic in pediatrics and is focused on children. I was very concerned that this was not a place where parents might want to bring their children.
We have two kids, 18 and 21, and when they were little, we brought them to pediatrics here at UCLA, and to be quite honest with you, we left and ended up getting pediatric services for our kids outside of UCLA because there wasn't a sense of patient-centeredness. It wasn't very effective or efficient clinic.
Even with my first walkthrough, I knew that the UCLA health system, operating system, applications of Lean would really help this clinic. The first thing was to start engaging the staff so that and engage them in projects that they actually could make a difference and that made a quick, visible difference. We started out with the 5S, and then we started implementing other kinds of measures. We did some standard work that created some efficiencies. We started to implement huddles, which is another way to engage staff in problem solving. It's also quick communication and it creates an environment of sharing and support and teamwork.
Everybody is looking out for the child and family, and everybody is able to speak up and work together to make sure that the right thing is done for the child.
The employees now, they give suggestions. And now that they see that, when they give their suggestions, things are getting done.
Active daily management is to actually talk to people, find out what's going on with them, and over time, gaining trust and encouraging people to think about problem solving and bringing solutions. Really, Lean is managing from the bottom up.
And right now they're adapting to it, and they really don't know that they're actually adapting to it because they started, like one-step sorting to make sure that everything was, all the desks and all just the work environment, everything has a place.
For me, a lot of things I can get to easier. I don't have to shuffle through. Like, I know where everything is, everything's in its place, so I can just kind of go to wherever it is that I need to go.
The patient rooms are extremely organized. From when you walk in, all the drawers are the same in every module in every room.
And as we started renovating and putting down the carpet, painting, it made a difference.
Everything is new, everything looks nice, and I think the patients are happy when they come in the office.
Starting from the lobby all the way to the exam rooms, just the turnaround has been wonderful.
It's fantastic. I'm so proud that we provide a setting that's very different than what it used to be, and yet it's in the exact same place. I mean, you just see a group of empowered staff. You see doctors working at the highest level of their license, not having to do things that can be done by others. Our medical assistants and our nurses working at their highest level of their license. There's no clutter. It's great. It's really fantastic. Paul.
I think right now with the management, the director, the CEO, the new team that we have, I believe that we are working in the right direction.
The clinic had been the way it was for many, many years without any change, and so the only way to possibly make these many changes in this period of time was to have the support of the department.
Our focus on efficiency and patient access and friendliness have really positioned us for the future.
The transformation that's happened over the last year in our pediatric clinic is astounding. My kids are too old now to come back to pediatric, but certainly my grandkids will. I mean, it is so, from the minute you walk in, it's clean, it's crisp, people are smiling, the clinic runs so effectively. You really get a sense that we've been expecting. We're here for you.